am living in Switzerland. Originally, I'm from Poland. I came all the way to India to speak with the doctors and to get some medical knowledge and how you treat patients here in India. As I understand, you have a high population here, so your experience here, it's amazing compared to Europe because we don't have this amount of patients. And I would like to ask you to introduce yourself and tell me more about you, what patients do you treat, and generally some information.
Hello, hi Natalie, it's nice to meet you. So myself Dr. Vitrag Shah, I am physician and ICU specialist. I have done MD medicine, then FMD critical care, and I have also done my last degree, European diploma in intensive care from London. So nice to meet you. So my main area of interest is complex rare infectious disease cases and ICU cases.
Okay, so like a special care and not special care, emergency or like...
Yeah, patient on ventilator, low blood pressure,
okay,
multiple invasive lines
so
in their body. So I like to treat patient, and that is my area of expertise, to treat such critical patients.
Okay, so difficult cases.
Yeah,
mostly.
difficult cases.
Okay. I also would like to focus a little bit on parasites in human body, and I heard India is very famous about it. What we read, and like we have the main medicines which are sold here: Ivermectin, albendazole, mebendazole. Are they officially used here in India?
Yeah, these medicine are used, but it's not common. It's common in rural area and area with poor hygiene, but it's not much common. Hardly I have used in more than 4 to 5 patients in last 1 year.
Okay.
So in pediatric patients, we need to use it for worms, for deworming purpose. But in adult, it is not commonly required. Except in scabies, we use these drugs.
Okay. How do this medication work in the body against parasites?
So in general, any antibiotic, antimicrobial, antiparasitic drug, they act by affecting the nervous system of that parasite or bacteria, or they act by inhibiting the metabolism.
Okay.
So they either inhibit the metabolism of parasites, or they act on the nervous system.
Mm-hmm. And during, like, if someone decided to, like, if it's needed to take, do they need to follow some diet, or do you recommend a low sugar diet for this type of situations or cases?
While giving this medicine, there is no particular relation with diet, because these are acute medicine, not required for lifelong or longer period. For shorter duration, they are required. So no specific diet restriction.
Okay. What are the most important risks or side effects when these medicines are used for longer period?
Yeah, so for longer period and for higher doses, if we use these medicines, or there are different formulations which are used in veterinary practice. If we use it in human practice, then there can be liver toxicity, bone marrow toxicity, neurotoxicity. So we have to monitor a liver function test and complete blood count regularly.
Okay, and which liver test would you recommend to do, like from your experience, to people that watch and would search for the answers? Because I read many, often on the internet, that they are asking which test they should do for liver.
So there are 2 different function liver have. One liver function for metabolism, and one synthetic function. Synthetic function is decided by producing protein and albumin.
Okay.
And one SGOT, SGPT, these are liver enzymes. Any damage in the liver in initial phase, they will increase the SGOT and SGPT, these enzymes level. So we usually advise to do SGPT level and SGOT level and bilirubin level.
Okay.
So in layman language, bilirubin is called as jaundice. Like if bilirubin is high, patient usually have jaundice.
So actually it's very important to control this during...
Bilirubin, SGPT and albumin level. These 3 are basic liver function tests. If they are abnormal, we get full LFT, full liver function test.
Okay. And can this medicine, like parasitic medicine, can interact with other medicines that you might know?
Yeah, definitely. So this is very good question, and not for only this medicines. Many other medicines have interaction with several medicine and food. So this is not very neglected apart from doctors as well. So patient also need to be aware for drug interactions. So certain anti-epileptic medicines and certain antimicrobial, these all medicine, anti-tubercular medicine, they have significant interaction with this ivermectin and albendazole. So we have to increase the doses as they increase the metabolism of these drugs, and due to increasing the metabolism, that drug level get cleared from the body earlier. So we don't get desired effect, and we have to increase the doses.
Yeah, I was looking on internet. People are like, it's very famous, ivermectin and other parasitic medication, because people saying that it works actually for cancer. And
there are very limited data. That is also for breast cancer. That is also one single study, and they have not proven of use of benefit. And the dosage which acts as anti-inflammatory effect in any virus like COVID or cancer, they are quite 10 times or 20 times higher than normal human dose, and these doses are lethal. So definitely it will act as anti-inflammatory, it will act as anti-proliferative, so it will help to decrease the cancer risk, but toxicity would be 100% with these doses. So that's why it's not successful yet.
What is one thing you think every patient should understand before taking any medication they read about on internet?
So that is one syndrome we call idiot syndrome, internet derived information syndrome. So patients should stop checking Google for these trivial details, because they don't have basic knowledge behind this. Like if you Google, you will get that vitamin B12 can cause coma. So anything can be possible with anything, but reason behind it, dosage behind it, when to give, when not to give, this we cannot obtain information at a glance, and it will create more anxiety. So I suggest them to trust your doctor, consult qualified doctor, and then ask whatever queries you have to your doctor, but don't take medicine yourself.
So actually everyone should be really cautious
avoid self-medication
and avoid reading all the time, and also focus on what the doctor says, because today in the world we're getting the information from everywhere.
So getting information is good, but the interpretation of this information is crucial.
Okay. And I have a totally different question regarding the thyroid.
Okay.
That I have problem in my life, and someone said me that the diet is very important, like gluten-free milk, low milk products, don't eat that. Do you agree that diet can cure or support thyroid?
Very nice question. Even many dietitians keep confusing the patient that you avoid cabbage and avoid this food. But this was in era when there was no iodine in the salt. Now we get iodinated salt everywhere. Government has mandated iodinization, and our routine recommended daily intake of iodine is satisfied with our routine diet. So previously goiter was very common in certain Himalayan belt and several other areas. So goiter is this midline swelling which causes thyroid. So now it is not common because iodine deficiency is past now. It is not in present. No issue is there. So whatever excessive iodine we advise via diet is not required, and it will not be allowed to enter in our thyroid gland as well. So dietary increase in iodine intake is not recommended in India as of now, but in certain areas, certain country where their routine diet is not having certain amount of iodine in their routine diet, then they have to take it.
Okay. What about selenium? Do you think it supports thyroid?
Yeah, it supports thyroid, but it's also not recommended. It's like vitamin for thyroid.
Okay.
So any patient with hypothyroidism, there are certain antioxidant or minerals which are recommended for particular system. Like for liver, there are different vitamins are there. For central nervous system, other chemicals and vitamins are there. It's like placebo effect. Frankly, scientifically, it is not required. it helps to increase the conversion of inactive to active thyroid hormone in the body. But naturally also it's occurring. So it is helpful only when there is significant iodine deficiency. If iodine deficiency is not there, then this conversion is going to occur without selenium as well. But selenium is good antioxidant, so in cancer patient or malnutrition patient and certain patient, it's useful.
And one more question, like I, for example, myself have very high anti-TPO, and my paramet, the FT3, FT2, whatever, TSH, it's all perfect always.
FT3, T4 are good and TSH is high.
All of them are good, the first three. The only antibodies, anti-TPO, it's always high, like 1000 for example.
So don't check it now, as it is for diagnosis. So you have Hashimoto autoimmune hypothyroidism.
Yes.
So it's going to stay, antibody is going to stay in your body, and eventually your all thyroid gland is going to stop working, and you may require higher thyroid doses. That's what antibody is indicating. So you just monitor your TSH and free T4 level. Anti-TP antibody is just initial diagnosis. Then for monitoring purpose, it is not required.
Okay. So in this kind of case, do you also suggest someone to take some medication or
just thyroxine?
Thyroxine. Okay.
So minimum doses of thyroxine to keep your TSH level between 1 to 4.
Okay. Good. Thank you.
Okay.
And thank you, doctor, for your. What screening do you recommend for women to prevent early stage cancer and yes, generally for the protection of the woman?
It's nice. Preventive care is also my area of interest. Prevention is more important than cure. So mammography after 35 years of age should be done in all women. And in their teenage, they should be vaccinated against HPV, that is human papilloma virus, which is the common cause of cervical cancer. So this, if in teenage group they are vaccinated, the efficacy of vaccine is very high compared to adult age group. So before any female is exposed sexually, HPV vaccine should be given.
Okay. And do you think this HP virus is curable or not curable? Like, because this is the main virus that causes the cancer.
So if vaccinated, then definitely it will prevent. But if cancer has already occurred, then also prognosis of this cervical cancer is very good. Even that cancer which are stage 4, they have spread to other organs. Then also nowadays with target therapy and immune therapy, patient do well for more than even 4 years, 5 years. You won't realize by seeing the patient that they are having stage 4 cancer. So if they are detected early and be given target therapy, then do fantastic.
Okay, so you recommend vaccination and as well as
mammography.
Mammography, and how often mammography? Once a year?
Yeah, once a year after 35 years of age. If not once a year, then at least thrice every year. And then as per that risk in mammography, there are grading by rates 1, 2, 3, 4, 5. So if they have high risk, then they should be screened every 6 to 12 months. And low risk, then they can get screened every 3 years at least.
Okay, thank you. So thank you very much, doctor, for your time and sharing your knowledge with us. This podcast is for information only, and please consult your doctors before making any final decisions. Thank you.
Thank you.